Welcome to the final presentation for Team Healthcare. We are delighted to deliver a summary of our company analysis and our industry recommendations. We'll start by introducing the companies we researched, then review a comparison of some key dimensions of their CSR initiatives and reporting, and then offer some potential concerns and recommendations which may be interest to anyone working in the healthcare industry. So we selected three companies in this space, two with significant pharmaceutical businesses and one hospital operator. All three were US based with significant international presence and impact. All three have been directly engaged in the recent global pandemic, and two of them in particular have been in the news a lot in the last 18 months as developers or co-developers and distributors of vaccines to prevent severe COVID infection. And these three companies are HCA, Johnson& Johnson, and Pfizer. Let's start by looking at Pfizer. Pfizer's environmental focus is based in three specific areas, which are energy efficient facilities by using sensors inside to reduce energy use, conserving water, reducing waste, and increasing recycling. Pfizer's environmental focus is to create an investment grade sustainability bond, which will fund specific initiatives in these areas and is targeted for a 0.75 percentage point return above treasuries. Pfizer's social focus is directed in two main areas, and that's improving the health outcomes for vulnerable populations and direct improvements in areas impacted by COVID 19. They have been particularly innovative in creating financing options for their health directed efforts, much the same way they have for the environmental investments. Johnson& Johnson, by comparison, has a five-part program for their overall sustainability program, which includes environmental as one of their five areas, but is also directly targeting health and social issues. These five areas are public health, supporting frontline health workers, environmental sustainability, diversity, equity, and inclusion. And finally, responsible supplier base. Some examples of their initiatives include reducing smoking, preventing disease outbreaks, and reducing waste streams. Their fifth responsible supplier based initiative encompasses social and environmental and is a recognition that for any company to really make an impact, especially a large global one, it is vital to tackle the supply chain impact explicitly. HCA primarily focuses on environmental health. HCA is a sustainability aware company and has areas of focus in four primary ways, which are recycling of commercial material wherever practical, reducing energy consumption, ensuring appropriate responses when using new equipment and ideas during renovations. And HCA is a member of the Practice Green Health or PGH, whose primary goal is to implement sustainable eco-friendly practices. HCA has been also awarded several recognitions for their green programs, including the PGA 2020 Award for Environmental Excellence. The primary areas of concern which we observed in our research include three main areas. Companies seem to have many different concerns, and it is difficult to imagine that all of them are strongly aligned with their true corporate purpose and strength. This dilutes the potential real impact they may have if their management and leadership must be working on dozens of causes at the same time. Many firms in the healthcare industry are burdened with persistent negative press due to the constant threat of lawsuits, FDA approvals, or rejections, and the very real fear consumers have that products they don't really fully understand may not always be perfectly meshed with their healthcare needs and risk. Finally, the industry partners do seem to still struggle with insufficient tracking. Both J&J and HCA lack a way to track new strategies, and Pfizer's program in this area is brand new. The recommendations to address each of these concern areas include, For the too many causes, they should carefully consider the potential alignment of each specific cause with the company's identified stakeholders. For the negative press risk, they should develop bold transparency with shareholders and employees and customers in order to gain trust so that negative press does not have a large effect on the company. And finally, for the tracking needs, they should create internal groups or committees of employees to keep track of sustainability issues and new strategies implemented. In conclusion, we reviewed the sustainability efforts of three companies in the healthcare industry, and that is J&J, HCA, and Pfizer. All three companies are focused on numerous sustainability issues. They each bring strengths to environmental and social areas of focus. And finally, the industry overall can benefit from improvements in tracking and transparency. Thank you.